Good afternoon, everyone, and welcome to Mondays with Mike and Joe. Thank you for joining us today. We are looking forward to talking about Providence Children's Development Institute-Newberg with our special guest today. Before we get started, I wanted to remind everyone that we will have a Q&A session at the end of the program. If you have any questions for our guest speakers or for Mike and Joe, please use the Q&A feature at the bottom of your screen. And again, we'll be answering those questions at the end of our program. Now I'd like to introduce Doug Kane, Executive Director for Providence Newburgh Health Foundation. Welcome, Doug.
Thank you, Nicole. I'm Doug Kane. I'm the Executive Director of the Providence Newburgh Health Foundation. I want to welcome you to our Mondays with Mike and Joe quarterly program. As the Executive Director of the Foundation, our purpose is connecting people to Providence to advance research, patient care, and wellness. We believe passion is at the heart of giving. Mondays with Mike and Joe is a quarterly virtual series focusing on the role the Providence Newburgh Medical Center plays in our community and how caregivers are working to improve health for all who live here. In today's gathering, if you have any questions for Mike and Joe or our guests, down at the bottom of this page, you will see the Q&A feature. Click on that button and you can ask questions. So what do you say we get started? Now I'd like to introduce Mike Donahue, a man who spent over 40 years as news anchor at Coin 6 in Portland. Mike is also a current board member of the Providence Newburgh Health Foundation. We are grateful for his service to Providence and our community. Please welcome Mike Donahue.
Hello, Doug. Thank you very much for that introduction. These people we're going to hear from today are performing an important service for Newburgh, for Providence Newburgh. I read where one father said, "Because of this therapy, my son is alive." I am joined today once again by Joe Yoder, the CEO of Providence Newburgh. Joe, while the CDC, I see now, considers Yamhill County low risk, hospitalizations statewide anyway are up. How are things in our hospital?
Yeah, good to be here with you today, Mike. Things in our hospital are going well today. We had a difficult week last week, but I'm happy to report that things are better today. And to your point about COVID, we are certainly seeing patients in the hospital with COVID. Now it's a little bit difficult this time versus previous waves or periods of time that we've looked at COVID incidents in our community, is that we're finding folks come to the hospital for things unrelated to COVID. We test them when they get admitted to the hospital and we find out they have COVID. So you might be here for something completely unrelated. We test you, you find out you have COVID, and it counts as a hospitalization. Now, I don't want that to give people a false sense of hope that COVID is just this benign virus running around out there. We are seeing case positivity rates uptick in our county and certainly through our test results with Providence as well. So COVID is alive and circulating well within our community. I just got to encourage everybody, take the right protections that you choose, and most importantly, wash your hands. On another topic, I'm happy to be here talking to our virtual audience out there today. And we've got an exciting topic for you: developmental therapy and resources for children and parents right here in Newburgh. So I'm excited to welcome two guests from Providence Children's Development Institute-Newberg, Malaya Lumsden and Laura Eubanks. Malaya is a manager of rehab services for physical and occupational therapists at Providence Children's Development Institute. After graduating from Pacific University's School of Occupational Therapy, she worked as a pediatric occupational therapist for 10 years, focusing on children experiencing challenges with self-regulation, sensory processing, self-care, and independent living skills, as well as behavioral management and social skills. Now, Malaya lives outside of Yamhill County, but is passionate about serving populations outside of the greater Portland metro area and bringing excellent and equitable services to all families at Providence Children's Development Institutes. Laura is a speech-language pathologist at Providence Children's Development Institute. Before graduating with her master's degree in speech-language pathology from Portland State University, she taught English in Chile and worked at an early interventional program in Bellingham, Washington. She joined Pcdi Newburgh in 2018 and enjoys working with kids of all ages on language skills, stuttering, social skills, and social engagement skills. She also works with children using alternative and augmentative means of communication, such as using a program on an iPad or dedicated device to speak. Thank you both for joining us today.
Great to see the two of you. Malaya, let me start with you. Give us the basics of PCDI Newburgh. Where is it located in town? What ages do you serve? How long is a patient, typically in treatment? Just give us the basics, please.
Thanks, Mike. So we're so happy to be here and talk about our services. Providence Children's Development Institute-Newberg is located off of Villa Road, at 310 Villa Road, actually. And we are a multidisciplinary outpatient pediatric clinic that serves patients 0 to 17 years old with developmental concerns and disabilities. We have a couple different locations. So we have our Newburgh branch that's close-ish to the hospital. And then we have 2 other locations, which we kind of call our hubs. That's at St. Vincent Hospital and the Providence Children's Child Center over off of 84 in East Portland.
Laura, does every Providence hospital have a PCDI?
So each of our locations has a branch of CDI, Providence Children's Development Institute. So those were the 3 we spoke about. So there's one at St. Vincent and Providence, Portland, as well as our location in Newburgh. We serve families with speech therapy, occupational therapy, physical therapy, social work, and our larger hubs, so the St. Vincent and Providence Child Center location has developmental pediatrics, psychology, nutrition, and audiology services. We also conduct summer camps, Providence camps for kids, as well as our summer intensive.
Well, I know
There we go.
Oh, go ahead, Joe.
I was just going to ask Malia, I appreciate that summary. I'm wondering if you could maybe just recap for us again, what services do we have specifically in Newburgh? And then what are some that services we would refer to some of our partners?
Great question, Joe. So in Newburgh, we have speech therapy, occupational therapy, physical therapy, and social work services available at that Newburgh location.
Let me give a question to Laura. Our county that we live in is known, of course, for hazelnuts and wine. It's also an area where we find a lot of horse ranches. I'm wondering if any of the local ranches or programs offer some kind of therapy for your patients.
Yeah, we do. Forward Stride is a organization that we partner with, and they provide with our occupational therapists hippotherapy, which is therapy that is on horses.
And how does that work? Do they try to horses give the kids some kind of confidence, or what's the benefit of that?
Yeah, there are lots of benefits. And Malia, feel free to add anything. But it's great for kids who have trouble building confidence, and for kids who are having trouble coming into the clinic to receive services, maybe out of anxiety with medical facilities or something like that. There's a lot of social skills that are built into interacting with other kids there, the horses. It's a sensory experience. Interacting with such a large animal builds core strength. Malia, is there anything else that I'm lacking?
Yeah, no, I think that's a great description of our hippotherapy program, which we partner with Forward Stride. I think the other benefit to that program is that it's a community-based program that families can access once they are finished with therapy services. So although they might start their therapies there, if that is something that fills that child and is fulfilling to the family and builds a sense of community for the family, they can continue on in that venue for services.
That sounds pretty exciting. I know my girls would love that. That sounds like a ton of fun. What a great way to engage kids. So as a parent myself, two beautiful little girls, how would I or other parents in our community know if our child needs extra help, and what signs should or could we be looking for that would help us understand that better?
Yeah, so as a parent or a caregiver, you can focus on milestones, such as when your child is starting to walk, use utensils for self-feeding or saying their first words. And then if you have concerns about your child's development, you can talk with your pediatrician or primary care physician about those concerns, and they can advise you on what to do next.
Is there a place that we could go out and find those milestones or sort of key targets to look at, or is that mostly done directly with our primary care physician?
It's best to talk to your primary care physician. The CDC does put out milestones as well.
Okay, so those are available if we wanted to go look them up.
Mm-hmm.
PCDI's online description says you treat children from infancy to adolescence. You told us earlier that you don't treat the medically fragile. So what is the most, you mentioned several, but what is the most common condition that you treat?
The most common condition is communication disorders, and that can be a wide range of things: understanding or speaking language, using speech that's understandable. And the common ages are usually between 18 months to 2 years when kids are first starting to speak. If they're having trouble forming their first words or putting their first sentences together. And for preschool age children, those are commonly referred when they develop more complex language, social interactions, self-help or living skills, and coordination skills.
How do parents connect with you? Do they need a referral from a doctor, or can they just make an appointment if they feel their child needs some help with their development?
When a family has concerns, they can bring it to their pediatrician or their primary care physician, and they can choose to conduct any additional screenings or provide a referral to a clinic or community resource, such as PCDI, or perhaps early intervention for additional evaluation in whichever area they're concerned.
So I'm curious, if once a family gets navigated or referred over to PCDI and goes through therapy and they're receiving treatment, I'm imagining there's some needs that come up along the way around equipment or other things, but specifically around equipment. Does PCDI help families and children get the equipment they need?
Yes. So for example, for me as an SLP, if I were to evaluate and assess a child with communication challenges, I might recommend an augmentative communication device. It's important that the child gets evaluated first before choosing a device so that we can recommend the correct one that's the best fit for them. But I have one right here. It's on an iPad, and you can see, I hope, let's see, maybe that's best. You can see the pictures that are icons there, and you can press the button to speak. So if a kid was saying mom, for example, to ask for everything, if they had a visual such as this, they could press it, juice, and they could ask for juice. Or if they were more advanced and they wanted to say a sentence, but they could only say a word, for example, they might be able to use this to say something longer, such as I want juice, please. And then they can touch the top to say a longer sentence if it's working. I want juice, please. Yeah, so that's an example.
And that's something that a therapist, in these pandemic days could use virtually online with parents and children, right?
We have ways to project the program onto the screen so that we can model what the words are for parents, and they usually, hopefully, will be able to get one of these at home so that they can do it with their own child.
You said your treatment is family oriented. Are there support groups for parents, for example, while their child is receiving treatment from Pcdi Newburgh?
Great question, Mike. At Providence Children's Development Institute, we see the whole family or caregivers as our clients. We encourage all caregivers to join the therapy sessions, and we believe that caregivers and parents are actually the key to outcomes and interacting with their children. So with the families, we're constantly working with them and establishing goals and training families to carry out these home exercise programs. So families partner with us, but outside of therapy is when we might partner with a community resource. One of our beloved partnerships is with Swindell's Resource Center. And that community resource supports families where they're at. It's an elbow to elbow, kind of peer-based resource for families to get knowledge around other support groups and community resources. They also provide guest speakers and events and really help families connect with access to resources in their own community.
Great. Oh.
Mike alluded to this a little bit with the iPad. Laura, I'm just picturing my daughters are so facile with those things now. That's got to be such a great tool. But that sort of has changed a little bit of the way you interact and deliver care. But how has COVID changed the way care is delivered for your guys' teams?
Since COVID, we now have virtual appointments, which are a huge benefit for us and for patients. For us, we can see the parent and their child in the home setting and coach them. It's great to see what they have available at home, which helps for carryover of therapy to home because they can use whatever they have at home for therapy. And sometimes it's just great. Children feel more comfortable at home than coming into a medical office, or if they live really far away, it helps for transportation as well.
So, this sounds like such an incredible service, especially one that's available to a community like Newburgh. I imagine demand is quite high, so I'm just curious, is there a need to expand services? And if so, what is demand like in our community?
Yeah, Newburgh is a really special community. Last year, we served 300 families with over 2,700 appointments. And I think with COVID, there is an increased demand for care, and just based on the lack of other options in the community for families. So, Providence mission of serving the poor and vulnerable, I think is key in the sense that children and families going through crisis around diagnosis and or difficulties with developmental disabilities is huge for families. So, we want to be that anchor for the Newburgh community, for families who seek additional therapy to support their children with developmental needs. And I think growing our services in the community to ensure that every child and every family has equal opportunity to access care for their children is a cornerstone of our mission. I think we'd love to grow the program, and, additional space would allow us to hire experts and additional clinicians to increase the number of families that we serve in the Newburgh and Sherwood. I think thinking about that drive to St. Vincent or the east side of Portland can be challenging for families. So we want to help ease their way and be close to their home and their communities.
Wow, so important. And with that level of demand, I'm assuming there's probably a waiting list too. Providence Newburgh's PCDI is in desperate need of some philanthropy. From where are you getting support now?
So we have been really, truly blessed over the past couple years. Our Hippotherapy program is funded through philanthropy, and that was specifically funded this year to expand for the full year by Providence Newberg Health Foundation. We also have the Newburgh Rotary that granted us some funds to update some of our therapy equipment and tools that we use with families and children that seek services. And then we are also receiving some additional funds from the Marie Landfrom Family Foundation. They've been able to help families actually purchase specific therapy tools that they may not have access to at home.
Well, I understand you're not saying this, but I understand that you're located in some crowded conditions, crowded quarters, and you're right next to the cannabis office in downtown Newburgh, and you have an air conditioner that goes on and off and isn't always reliable. I don't know about anybody else, but when this program is over, I'm writing a check to the Newburgh Health Foundation to help anyway, and I challenge anyone else out there to write a check to help you guys reach this need. Man, it's an incredible need. And like that one father said, it can save lives.
Yeah, and we've been so blessed. Just this past weekend, one of the local Newburgh families, the Bel Air family, held a pickleball tournament for us and large fundraiser. So really, they are assisting us in trying to achieve those goals and giving back to the children. And it feels fantastic to have that kind of community support. It helps fuel us to give back to those families and keep our excellent services coming.
Well, thanks for the explanation of what you do. Nicole, back to you for questions from our audience.
Yes, and we have several questions from our audience today. The first question is, how can people get involved? Can they volunteer with PCDI?
Great question. So yes, we have, due to COVID, we've had to put our volunteer services on hold for just a short period for safety of the patients and families, both volunteers and those seeking services. So we are aiming to bring back those volunteer services. I think, like Mike said, being able to donate, even if it's just a few dollars, that can help families get the equipment that they need and or contribute to looking for a larger space to grow our services. But yes, we will be getting volunteer services underway.
Great. Another question is, what happens when one of your patients turns 17? And I'm assuming this person is asking because you said you serve up to age 17. So what happens when someone ages out of PCDI?
So if they're an existing patient within our clinics, any of the clinics, we really work with their pediatrician or primary care physician to try to partner and find other appropriate community resources. Sometimes that's where we ask our social work team to get involved and or reach out to Swindells. Depending on the child and what their school services might be, those kids sometimes have pre-vocational skill building activities provided through the school. So we want to partner and make sure that those families are plugged into the more adult services that the community has. So that may be developmental disabilities, that could be connecting with the Oregon vocational training community. It depends on each child and their need and what services they have in place, but we do try to partner with that individual's primary care physician to keep that coordinated, to get them the services that are beneficial.
Great. And Laura, this sounds like the question is aimed at you. What is speech therapy like and how long does it last?
That is a complex question. It depends on what the needs of the child are. Our speech therapy is generally play-based. So we use play as a medium to help the children develop skills. Play is like the work of children. I think that might be in the title. It helps engage the kids, and when you're having fun, you're learning more. And usually we involve the parents. The parents come in, we work with the parents, they're part of the session. A typical session is usually 45 to 50 minutes. We have sessions that are maybe once a week, maybe once every other week. And the amount of speech therapy that they might need definitely depends on the child and what their needs are.
Great. And this is our last question. Someone said, what is hippotherapy?
Great question. It has a different name. So hippotherapy is, it can be speech therapy, occupational therapy, or physical therapy that's typically conducted with the use of a horse or on a horse. So at Forward Stride, there are several therapeutic horses that are utilized in a session. Valerie Sampson, one of our longtime occupational therapists, sees patients. So I was out touring the facility, and one of my former patients was now Valerie's patient at Forward Stride. And so the child was riding the horse, working on postural control and strength, also working on self-regulation and learning to take cues from the therapist or instruction to conduct different types of activities. So at one point they were using rings and tossing them over pegs. They were pointing to different letters and working on letter recognition, but it's all done at Forward Stride on a horse with a volunteer and therapist.
Great. That sounds amazing. And what a benefit for the patients out here in Newburgh. Those are all the questions that I have from our audience. So Laura, Malia, thank you so much for joining us today. We'll let you guys get back to work. Mike, Joe, it's always a pleasure to have you both here. And at this time, I am going to welcome back Doug Kane, our Executive Director for the Providence Newburgh Health Foundation.
Well, thank you again, Malaya and Laura, for being with us. And again, thank you, Mike and Joe, just for being with us as well. And I want to thank you all for joining us today. As a reminder, our next Mondays with Mike and Joe is scheduled for Monday, October 17th at 12 noon. Keep your eye on your emails for more details on that. We want to give a big thank you to Brian and Kathy Bellairs for hosting a wonderful event this past Saturday that Malaya had mentioned. It's Wine Country Pickleball. It was an event supporting our Providence Children's Development Institute here in Newburgh. And just on Saturday alone, we raised just under $20,000 with donations still coming in, along with several thousand in generous in-kind donations as well. So Brian and Kathy, thank you so much. We'd also like to invite you to our annual Hearts of Gold event this summer. After 3 years, we are excited to welcome our community back to an in-person event. So mark your calendars for Thursday, August 18th for a fun night at Providence Newberg. We will be raising funds at the event for our emergency department and honoring 2 great community members, Tualatin Fire and Rescue and Amy Wolf. For more information, please visit providencefoundations.org/Newburgh. That's providencefoundations.org/Newburgh. A special thank you to our presenting sponsor of this event, ADEC, for their generous support. We hope to see you there on Thursday, August 18th. If you would like more information regarding the Providence Newburgh Health Foundation and ways you can support our patients in need, visit our website at providencefoundations.org/Newburgh, and you can also call or email me. On the screen is my contact information. Also, if you have any other questions for Mike and Joe, let me know as well. We will be following up on questions not answered during this program via email. Thank you all again for joining us, and we look forward to you joining us again on Monday, October 17th.